Ascension, the second largest health system in the United States, began working with Google to improve its patient care system. But how does Project Nightingale works? Through Project Nightingale, Google is allowed access to the data of the Ascension healthcare network. Google hopes to use its partnership with Ascension to create the framework for a product which it can sell to other health systems. The corporation claims its end goal is to develop a comprehensive Google search tool that can collect and store a health system's diverse patient data in one place. In return, Ascension is provided access to any new software and services created by Google, such as its developing centralized search tool that can collect all PHI into one place and can be integrated into electronic health record systems. Ascension hoped that faster and easier access to patient information and enhanced data mining would help healthcare providers and benefit patients. Project Nightingale gained public attention in November 2019 when a Wall Street Journal article was published, revealing the previously private partnership between Google and Ascension. The Wall Street Journal first reported on Project Nightingale on November 11, 2019, writing that doctors and patients had not been notified of the project and that 150 Google employees had access to the patient data. Google Health Chief David Feinberg responded to the report in a blog post, saying all employees with access to protected health information went through medical ethics training and were approved by Ascension. Since then, various concerns have been raised about the project and whether it threatens the data security of protected health information. However, the potential for advancements made through the partnership could increase productivity in healthcare systems and create improvements in clinical quality and patient safety.
What factors or events led to the introduction of this Project Nightingale? Obviously, doctors and nurses love caring for patients, but they are not always equipped with the tools they need to succeed in their mission. According to Mr. Conrado of Ascension, in order to empower their caregivers to provide safer, more effective and efficient care 24/7, they are testing point-of-care tools for their clinicians to quickly have access to more complete and specifically tailored patient data. Ascension hopes to create tools for physicians to access patient information more quickly. So, with the partnership of Google, they build tools including artificial intelligence and machine learning to make health records more useful, more accessible, and more searchable. That's why the partnership called Project Nightingale is made to improve how information is used for patient care.
Most obviously, the ethical dilemma introduced in Project Nightingale is regarding its use of information technology. In the present day, it can be considered that digital information is powerful where it can bring both development and damage in our society. Hence, the project poses a threat to the data protection and privacy of the patient's health history across the states of US. Even though Ascension and Google cite a HIPAA, Health Insurance Portability and Accountability Act, where Google does not have a right to use and change the records collected, it does not stop Google and its employees from accessing the patient's data, including lab results, diagnosis, and hospitalization records. In addition to this, the affected patients and physicians were not informed about this data sharing. Moreover, with the ambition of Google to develop their software by involving artificial intelligence technology and machine learning, it could also pose a threat to the ethics and artificial intelligence where customers will be interacting with a program rather than a human being. Questioning the moral and ethical issues surrounding the Project Nightingale would ensure that the innovation is effective and still contributes for the greater good. According to the head of Google Health, David Feinberg, MD, health information should be private. Also, investigation on how Google collects patient information is being facilitated to ensure that the signed HIPAA have been observed. With these actions, the use of the Project Nightingale is being controlled, where it would only be used for its main purpose of providing a cloud platform to store patients' information and researching for the development of in healthcare. Considering the ethical issues that an innovation may conduct can avoid it from creating a new problem in our society and endangering the rights of its clients.
So why is it important to study science, technology, and society? The study of science, technology, and society is a growing field that focuses on how our society, politics, and culture shape science and technology today. This field studies contemporary controversies, philosophical questions, and policy dilemmas. The rise of new science and technology innovations today provides economic and social development. It increases productivity and reliable outcomes that will help the increasing problems of the society. By studying science, technology, and society, students will know the effects of science and technology to our society today. What will be the impacts, what are the benefits and risks of technology and scientific advancement, and how it will affect our society. For example, is our assigned dilemma, which is Project Nightingale. It is a partnership between Google and Ascension that collects patients' data without them and the doctors being notified. By the study of science, technology, and society, it may examine the pros and cons of the dilemma.